In Ghana, the National Blood Service (NBS) has never met its annual target of 300,000 units of blood. However, in the first quarter of 2020, what looked like an improvement over previous year's performance was eroded by the Covid-19 pandemic. Stephen Adai-Ban is the Public Relations Officer of NBS.
For the first quarter in 2020, we were able to achieve about 57%, 57% of our target, which is the half of the 300,000 units that we projected. So I think that it was quite good. Yeah, it was promising that at least we would have done better in the second quarter and beyond. But for COVID, we were not able to.
Many healthcare institutions rely heavily on the NBS for blood donation drives. To avert a further worsening of the situation, the National Blood Service had to implement some tough measures.
You know, because of the COVID situation, most of our regular donations were cancelled. And you know, we get the chunk of our donations from the second cycle schools, the churches, the organized groups, and also the corporate organizations. But you know that almost all of these organizations were affected by the restrictions. Measures that we put in place was to make sure that we do a call-up of our donors. So we look through our database, those who are due to donate, we call them, and then came into an agreement with the Ministry of Health and then the security agencies to prepare a pass kind of.
During this pandemic, the NBS has come to rely more and more on the family replacement system.
That was what really helped us. And other facilities, you know, most of the facilities who come here for blood also have a system to get the family replacement system done at their facilities. A lot of them rely on that family replacement system. That was what saved the situation. Had it not been that, it would have been a very serious and difficult time for Ghana.
The demand for blood transfusion is high in Ghana, like many other African countries. This is because of the high prevalence of anemia, especially due to malaria and pregnancy-related complications. In the country's capital, one of the major referral health facilities, the Greater Accra Regional Hospital, is reeling under the impact of this pandemic. According to a 2020 report on maternal and perinatal data at the hospital, obstetric hemorrhage accounted for the leading cause of maternal mortality, representing 44.8%. This means about 5 out of every 10 maternal deaths at the facility could have been prevented if there is sufficient blood at any given time. Dr. Emmanuel Sropanyo is the medical director.
So you can see that a hospital of this stature, that is, we deliver about 700 women every month, sometimes 800, and this is what we have. This is not enough. Of all the things that women go through in motherhood, at the point of delivery, that is the most difficult and the most painful part of the entire motherhood process. And to add injury to insult, there are some women at the point of delivery, after they have delivered, then they begin to bleed and bleed and bleed. The medical system has medications and procedures that we do to stop the bleeding. However, there are some of the women who do not respond properly to these medical procedures. So they bleed and bleed. Sometimes we have to then go to theater and remove their womb, assuming she came for the first child, and then you have to remove the womb. And then imagine what this woman will go through. And sometimes you do all these things, and the woman may still lose her life because you did not have adequate pint of blood in your blood bank.
Beryl Ernestina Richter's report for Joy News.